Hi all, this is Navya and I have admitted my grandfather M. Ramakrishna in Yashoda Hospitals, High-Tech City. He's 86 years old. When we have admitted him, he had a Parkinson's problem with extreme lung infection and his oxygen levels have dropped to 60s range. So we were very much tensed when we brought him, and after admitted him, the hospital, they had put him on ventilator, and he was on ventilator for almost 3-4 days. Dr. Somnath Gupta was treating him. When we have admitted him, we had very little hopes that we would take him back home, but today we are very happy to say that we are taking him home, and we are taking him home with a very smiling face. He is also smiling, and we are very thankful to Yashoda hospital team, and a very special thanks to Dr. Somnath Gupta. He has been there from the beginning till today. While we discharged him, he was explaining us very little details and also setting us the realistic expectations of what is happening across the treatment. He not only gave the treatment, he also gave us the emotional support, the right support that has to be given to the patient attenders, patient's family and all. Thank you so much to Yashoda team for giving us hope and proving that even 86 years old patient who is on ventilator can be recovered with strong willpower and great treatment. Thank you so much.
నా పేరు రాధాకృష్ణ. మా ఫాదర్ 85 years old ఫాదర్ వండర్ఫుల్ మిరాక్యులస్ రికవరీ స్టోరీ గురించి చెప్పబోతున్నాను. మా ఫాదర్ని 29th November 2022 నాడు చాలా సీరియస్ కండిషన్లో, హోప్లెస్ కండిషన్లో యశోద హాస్పిటల్ హైటెక్ సిటీ బ్రాంచ్లో కొత్తగా స్టార్ట్ చేశారు 3 months బ్యాక్. అందులో తీసుకొచ్చాం. సో డాక్టర్స్ వర్ ఆల్సో హోప్లెస్, ఎందుకంటే ఆయన కిడ్నీ డ్యామేజ్ అయిపోయింది, లంగ్స్ డ్యామేజ్ అయిపోయి, హార్ట్ కూడా బాగా వీక్గా ఉంది. ఫస్ట్ డే అయితే డాక్టర్స్ ఫ్యూ అవర్సే అన్నారు, ఫ్యూ అవర్స్ కంటే హోప్ లేదన్నారు. మేము కంప్లీట్గా హోప్ వదిలేసుకున్నాం. బట్ ఇక్కడ డాక్టర్స్ ఎఫర్ట్స్ ఐసీయూలో రియల్లీ ఆ కేర్ అది కూడా అప్రిషియేట్ ఇట్. అండ్ పర్టికులర్లీ సోమనాథ్ గుప్తా గారు ఒక ఫ్యామిలీ మెంబర్ లాగా ఆయన తీసుకున్న కేర్ మాత్రం మేము మర్చిపోలేం. అంటే రియల్లీ మా ఫాదర్ రికవరీ అనేది ఒక వండర్ మిరాకిల్. దీన్ని ఎక్స్ప్రెస్ చేయడానికి ఐ డోంట్ హ్యావ్ వర్డ్స్ టు డిస్క్రైబ్. ఎందుకంటే ప్రతి టైం టు టైం పేషెంట్ కండిషన్, మా ఫాదర్ కండిషన్ నాకు అప్డేట్ చేస్తున్నారు డాక్టర్. మేము ఎప్పుడు ఫోన్ చేస్తున్నా సరే ఇమీడియట్గా రెస్పాండ్ అవ్వడం కానీ, అలాగే పేషెంట్ కండిషన్ గురించి ఇలా చేయాల్సి ఉంటుంది, ఇప్పుడు ఏం చేద్దామని మాతో ఎప్పటికప్పుడు ఏ టైం అయినా డిస్కస్ చేయడం కానీ, అలాగే టైం టు టైం ఫీడ్బ్యాక్ తీసుకోవడం కానీ, మెయింటెనెన్స్ కానీ. సో ఎక్స్ట్రీమ్లీ గుడ్. ఐఎమ్ వెరీ మచ్ హ్యాపీ. ఈరోజు మా ఫాదర్ని డిశ్చార్జ్ చేసి చాలా మంచి కండిషన్లో ఇంటికి తీసుకెళ్తున్నందుకు మాకు చాలా హ్యాపీగా ఉంది. సో ఐ రియల్లీ థ్యాంక్ ఆల్ ద డాక్టర్స్ అండ్ ద సపోర్టింగ్ టీమ్ ఆఫ్ Yashoda Hospital, High-Tech City. Thank you.
Hi, I am Dr. Somnath Gupta, consultant physician and diabetologist, working in Yashoda Hospital's High-Tech City branch. He is a case named Ramakrishna, aged around 85 years. He is bedridden with multiple comorbidities. He has recent cerebrovascular attack, followed by which he had left hemiparesis, and he is on antiplatelets. He has Parkinson's disease. Recently he presented with complaints of altered sensorium, severe breathlessness, and on emergency to casualty, his level of consciousness is down. He is not following commands. On deep stimuli, there is a mild eye opening, saturations were down, and ABG showed severe metabolic acidosis with respiratory component adding up to that. He was immediately intubated, blood pressures were low, he was started on inotropic supports. We could see a bed sore, pressure sore in fact because of bedridden status, and he routine investigations showed elevated WBC counts. Chest X-ray, CT chest showed bilateral pneumonitis because of aspiration. His altered sensorium looks like because of septic involvement and because of low sodium levels, hyponatremia. So cause of hyponatremia has been evaluated. He was started on 3% NS, multiple broad spectrum antibiotics, empirically started, cultures were sent, and he was started on ventilatory supports. Gradually, 1 or 2 days, the patient started improving, level of consciousness improved, and his sensorium improved, his vitals, blood pressures improved, inotropic supports removed, and the ventilatory support slowly weaned off. He was able to maintain with minimum oxygen supports. So he was planned extubated. He was monitored for next 24 hours in ICU, and cultures were proven. Antibiotics were modified according to culture and sensitivity. Gradually, level of consciousness was much better. With room air, he was maintaining around 96 sats, and his WBC counts improved, sodium levels improved. He was shifted to room. This whole process took around 5 to 7 days for the patient for the recovery. This is normal case which we usually see, like sepsis with multi-organ involvement. Patient had acute renal failure, cardiac involvement. He had some kind of ventricular tachycardia, ventricular fibrillation in between. He was started an amiodarone. So routine sepsis with multi-organ dysfunction kind of case. But the main take-home point in this case is he is 85 years old with multiple comorbidities. He had a severe sepsis with multi-organ dysfunction. A lot of people think that once the age crosses more than 75 or 80 years, if there is a multi-organ attack or if there is an infection, the patient wouldn't survive, and they don't go for advanced resuscitation measures. So if the patient level of consciousness is maintained, and with initial course of sepsis guideline maintaining treatments, if patient is improving, this clearly makes a scenario that it's better to continue counseling the patients. The patient attendance has clearly listened to our words and has been taken our advice, and the patient recovered in such a way that he is able to talk, he is able to judge. His orientation is such a way that better in time, place and person. Thank you.